Welcome to the Graphic Medicine Podcast. I'm your host, MK Serwick. With Ian Williams, I co-run graphicmedicine.org, a website that explores the vast intersection of comics and health. On today's show, Professor of English from The Ohio State University, Elizabeth Hewitt, with her presentation from last year's Comics and Medicine Conference in Riverside, California, and an interview with Professor Ann Fox about what she's reading and her new graphic medicine course. But before we begin the show, I want to tell you that support for the podcast comes from the Penn State College of Medicine Department of Humanities, the nation's oldest humanities department within a medical school. Pioneers of innovation in medical education since 1967. To learn more about Penn State College of Medicine Department of Humanities, go to www.med.psu.edu/humanities. In my first segment, Graphic Medicine News, things are still progressing well for the upcoming Comics and Medicine Conference this summer in Dundee, Scotland. Hotel rooms are now bookable, and registration should go live in the next week or so. Go to the Graphic Medicine website to find out more. For the latest publications, news stories, event updates in graphic medicine, be sure to like our Facebook page. That's the best way to stay connected to the vast worldwide graphic medicine community. In my second segment, Elizabeth Hewitt. Elizabeth Hewitt is an associate professor in the Department of English at The Ohio State University, where she teaches American literature, film, and popular culture. Her scholarship emphasizes the intersections between literary form and social praxis. And now I hope you'll enjoy her presentation from the 2015 Riverside Conference entitled Incurable Time, the Graphic Temporalities of Autoimmune Disease. I've dropped images from her presentation slides in the feed, so keep an eye on your screens.
I am somebody who does not study comics or medicine. I study early American literature, but like maybe many who the portal into medical narrative for me was Sontag. And so I kind of want to just start by mentioning or sort of explaining this project, which is that, because my portal was Sontag and her ambition to purify the experience of disease from what she describes as the lurid metaphors, my original question was, well, the diseases she speaks of as being landscaped with such lurid metaphors are tuberculosis and cancer. So my initial query was, these are the diseases on which lyrical and narrative figures have been cultivated and shaped and decorated, but what about those diseases for which there have been no well-fashioned metaphors and no stereotypical narratives? How do authors translate the experience of chronic disease into art? How does one tell a tale about dual citizenship, to use Sontag's infamous metaphor, when chronic disease fundamentally repudiates the distinction between the kingdoms of the well and the kingdoms of the sick? So in what follows, I want to look at two graphic memoirs about chronic disease that don't provide a travelogue into illness, but instead outline an artistic project of what I want to describe as something like episodic meanderings into kingdoms that are neither healthy nor sick, and whose landscapes seem remarkably barren of metaphor. So I want to start with Jeffrey Brown's memoir, A Funny Misshapen Body, from 2009, and especially focused on the tale in the middle, which is called Semicolon, which narrates Brown's diagnosis of Crohn's disease when he was a teenager. Most of the book, and it's about a 300-page book, is not about the disease, and it largely focuses on his artistic coming of age. His study in art history, his professional relationships, his disenchantment as an MFA student, and the writing of his first book, called Clumsy. But although Crohn's disease is not a central theme, and although Semicolon, the short story within it, only occupies about 40 pages of the manuscript, in some ways its subject matter dominates the entirety of the volume. And indeed, we even notice the significance of Crohn's disease insofar as this is the image that's in the title page, which is of Brown's scarred belly, which is, of course, a consequence of the operation he has when he's a child that he describes at some length in Semicolon. If the long scar visually highlights the physical ravages of the disease and its attack on Brown's funny, misshapen body, then the story, semicolon, quite differently emphasizes its persistent monotony. He begins by explaining, I don't know when it started. By the time I realized something was wrong with my digestive system, I couldn't remember it being any other way. This assessment, I couldn't remember it being any other way, is crucial to the visual and narrative form that shapes Brown's story. Although the experience of diagnosis is located at a narrative crescendo when Brown's father rushes into the hospital in the midst of acute pain, and although the story is orchestrated around the climax of Brown's operation that brings his disease into some degree of remission, the large shape or arc of the plot repudiates such narrative apogees. Consider, for example, the moment of diagnosis, when the doctor tells the teenage Brown the name of the disease he has, a revelation that is made in decidedly understated rhetorical terms. It's not life-threatening, but there's no cure, so you'll have this for the rest of your life. This is something we can treat, so you'll be able to live a fairly normal life. Here, Brown is told that the symptoms, that which has brought him to the ER, will be with him for the rest of his life, and his experience with the disease will become fairly normal. The fairly normal quality of the experience is rendered by the visual style of Brown's 6-panel slides. And there are no deviations. Well, there are few deviations from this basic structure in the entirety of the book, and none at all in semicolon. And the effect is to produce a kind of ordered symmetry to the story, but also to cultivate, at least for me as a reader, a kind of visual monotony, a monotony that replicates his experience with the disease. I couldn't remember it being any other way. In a later story, Brown describes being asked by his art professor why he makes all the panels the same size, and he responds, well, I don't want to make any one panel more important. This seems likewise to be the credo with which Brown approaches the representation of disease. His illness is not more important than anything else. Instead, the illness is experienced as the repetition of the essential contours of its identity. You might want to think about, given what my colleagues have been speaking of. This pattern repetition is essential to Brown's autobiographical work as a whole, since his topos is the mundane, and he plots these incidents in an episodic style. The pun of the story's title, semicolon, highlights this narrative structure. Semicolons are the punctuation mark of parataxis. They gather clauses without subordination or causality. Brown's Crohn's disease, which of course is an inflammation of the bowels and colon, means that many of these episodes are punctuated by trips to the toilet. And indeed, the story begins by recollecting the childhood embarrassment caused by the urgent need to go to the bathroom. It's a repeated motif throughout the narrative. And I'm just giving you a couple of examples of it. And it's interesting that Tom Humberston's 24-hour comic, which I just came across in writing this paper, likewise emphasizes the repetitive iconography of the bathroom door, almost like semicolon, you know. We see, and here we see the adult Brown at his drawing. This is actually Humberstone at the end of his narrative. Very last page, saying that he has to leave the drawing table. So and this is a 24-hour comic, so he had to do it in 24 hours. The last page of the comic is him saying, and you know, the thing about trying to give closure to it and then saying, I got to go because I have to go to the bathroom. This is precisely how Brown ends semicolon, which is we see him at his drawing table remarking, my system feels pretty good these days, and then usually, and he runs off again to the toilet. So because there is no cure, no terminus, no climax to the disease, both authors must briefly abandon their drawings, which I think we can also understand as an abandonment not just of this particular drawing, but of art, and their story, reminding us that their art and their stories come from the funny misshapen bodies that will be perpetual patients. The experience of perpetual patients is also articulated in the title of Julia Wirtz's 2011 collection, The Infinite Waste. Like Brown's book, Wirtz is a collection of autobiographical sketches. And as with Brown, it's interesting to me how many similarities there are, I should mention, between Brown and Wirtz's book, despite the fact that they're chronicling a different kind of illness. Wirtz's experience of a lupus patient is sandwiched between other tales that are primarily focused on her coming of age as a cartoonist. Yet the centrality of the disease is underscored by the fact that the book's cover is taken from a page that depicts Wirtz surrounded by how-to manuals that will supposedly teach her how to live with her newly diagnosed disease. And Wirtz explains in a prose introduction that this is from Wirtz, despite the various themes in this book, the heart of it all revolves around my illness and subsequent discovery of comics. But the story does not begin with disease. Instead, it commences with a fantasy of movement and an exultant desire to get the hell out of the town I grew up in. The story thus seems as if it will take the form of a picaresque. Like Tom Jones, Wirtz is going to chronicle her movement away from her birthplace. And we're 20 pages into the comic before Wirtz first mentions any physical malady other than homesickness. Wirtz narrates the shift to photography with a simple temporal transition. A few weeks after I settled into my life in San Francisco, I began to feel off. It began with unwarranted lethargy. This recognition is accompanied with a portrait of her falling asleep in class as her professor described a key feature of Platonic aesthetics. A work of art is a copy of a form. This understanding of art as a necessarily inadequate representation of form is, I think, central to the project at hand. The original thing, the form, Wirtz aims to represent in her own work of art is the experience of unwarranted lethargy, of high fevers, and of disabling joint pain. And this ambition raises several aesthetic conundrums. Why would you want to copy the experience of exhaustion, inactivity, and ache? And then, how would you go about making a copy of this form? The key to both questions is found in the literary form comics with which Wirtz chooses to make her copy. We see that the visual monotony of the six-panel layout, again reminding me of Brown, and the minimalist black and white line, and again, even there, you could tell the difference between Brown and Wirtz, but they both have a kind of thick black ink in which there's a lot of black taking up the space of the page, is uniquely suited to render the extended moments of inactivity that characterize Wirtz's physical symptoms. She renders the unwarranted lethargy with scenes of unmoving prostate bodies. The page is kind of relentlessly simple, I guess you could say. And the static repetition also visually captures the temporal collapse that Wirtz describes when, for example, she explains her perpetual postponement of making a doctor appointment. Tomorrow turned into days, that turned into nights, that turned into weeks. She similarly recalls waiting to hear from the doctors. I'm miserable and impatient. It feels like I've been waiting for infinity, which of course is the title of the entire collection. According to a conventional plotting of illness, the end to her wait should come when Wirtz receives her diagnosis of systemic lupus erythematosus. At that moment, we might imagine her story would turn into a travel narrative from which she would ultimately either return to the kingdom of the well or die. But of course, this is not what happens. Fortunately, her doctor tells her, it's treatable. Unfortunately, it's incurable. It can go into periods of remission, but it is a chronic illness. And this presents a formal dilemma that Wirtz describes within the text. How can she narrate a disease, the primary feature of which is that it will manifest itself as, quote, a long line of indignities to be endured? Wirtz even describes her own bafflement. I'm sick of talking about my lame, chronic, incurable disease. Who even cares anymore? Or later, she describes listening to, quote, my doctor yammer on about how I'll be sick forever because there's no cure for lupus or whatever. These confessions of her apathy towards her own disease are crucial to the disease itself, since Wirtz discloses that the most insufferable of all her symptoms, her being diagnosed, her most insufferable of all her symptoms is her excruciating boredom. And I should note that this is, again, you can kind of see the kind of repetition. This is one of the few panels, in fact, in which there's actually something kind of visually different that happens, and it's the moment where she has the epiphany of discovering comics. And it happens on this kind of like excruciating boredom. Comics, what is this? The boredom is, however, key to the aesthetic project she constructs. Her illness is boring, Wirtz thinks, because it does not involve tragedy. It wasn't that bad. That's a quote from Wirtz. It's not cancer. I'm not dying. I wasn't even hospitalized. Her disease is simply the long line of indignities on which daily experience will be strung. This formula is also the template for comics. Wirtz provides a simple black-line caricature of herself as she meanders through a series of quotidian and comic episodes. It's not merely then, as this page shows, that Wirtz finds catharsis in comics, but that the basic grammar of comics provides a template for copying the form of chronic illness. Wirtz, for example, renders her activity as a diary cartoonist, like Julie Doucet might, and actually that's whose work she discovered, kind of epiphanic moment. As a transcription of mundane events. Indeed, Wirtz voraciously consumes comics. She decides to transcribe her own mundane daily events into comic form. But she also transcribes her experience as if she were a protagonist in the funny pages. She is like Happy Hooligan, Charlie Brown, Crazy Cat, recursively working her way through a series of comic episodes. Here is Julia mistakenly Googling cute bear photos in San Francisco. Here she is finding cans in her bag. Here she is going to the mall high trying to buy cookies. It's literally, Crazy Cat and getting hit by a brick. Only, I guess there's a little bit more, little variance. In reading and writing comics, Wirtz discovers that her formal enterprise should not be to translate the monotony and lethargy of disease into a developmental plot, but to document the plotlessness of chronic disease. At the end of the story, Wirtz returns home to meet a possible boyfriend, and she acknowledges the irony of this retrogressive movement, since her tale began with a celebration of escape from the same hometown. Her mom asks Wirtz if she plans on telling the boy about her illness, and Wirtz rejects the vocabulary of the question, telling her mom, "It sounds so tragic when you say it like that. I'm insisting I'm just a little bit shitty all the time." Comics, and especially the minimalist style we see in both Brown and Wirtz, can best mimic this feeling of monotonous pain. They can do this because their storytelling can escape the relentless insistence on causality, subordination, and development. And they can do this because comics can capture the static tedium of perpetually feeling sick. The paradox of comic mimesis, then, is that even though we might assume it as an artistic form that cedes to any ambition for realistic imitation, for its practitioners, it yields a representational strategy uniquely suited to capture the form of chronic illness, of feeling a little bit shitty all of the time.
Mm-hmm. Great. And for my next segment, what are you reading? Today I caught up with Ann Fox, professor of English and Disability Studies at Davidson College in North Carolina. We discuss her recent reading and her new graphic medicine course. So Ann, welcome to the Graphic Medicine Podcast.
Thanks, MK. It's great to be here.
So tell me, what are you reading?
Well, it's interesting. Right now, I am reading a couple of things in tandem, and I've just started one. I'm reading The Story of My Tits in conversation with Cancer Vixen, and I've read Cancer Vixen before, but I'm currently teaching it with my graphic medicine class, and I'm finding it really interesting to read the two of those works in conversation, because in terms of something like Cancer Vixen or Cancer Made Me a Shallower Person, there's such an interesting focus on the different experiences of being a breast cancer patient. But what I love is that The Story of My Tits actually starts from the beginning. And so I'm really loving the idea of thinking about how are we in relation to our bodies even before we get to the experience of having the bodily integrity of ourselves questioned. So that's what I'm reading right now.
Oh, that's fantastic. So tell me more about your graphic medicine class. Is this the first time you're teaching it?
This is the first time I'm teaching it, and it is largely thanks to you. You really inspired me when I heard you speak at the New York Academy of Medicine at the Vesalius 500 Festival. And, I've been teaching disability studies for about 15 years, and I had been reading graphic novels here and there and thinking, wow, there's a lot of these, that are appearing in terms of illness. And when I heard you speak and met you and met Ian, I was really inspired to think about how could this become a completely different way into teaching disability studies and teaching the representation of disability and illness in literature. So it's the first time I'm doing it, and it's in the context of a course called Introduction to Literature, which is a 100-level course. And it's in the context of a small liberal arts college, Davidson College. And I have a whole mix of students, everything from psych majors to pre-med students to English majors. So it's a really interesting mix of students.
And tell me more about that. Tell me more about teaching disability through disability studies through using graphic memoirs. How has that kind of taken form for you?
Well, I think the graphic memoir has pushed me in really compelling ways. For so long, I've been teaching about the representation of disability in text. And this visual component adds a completely new dimension. I know this isn't something that's new to you, but hearing you speak about it and Ian speak about it really made me feel a little bit braver about sort of turning to what can the visual do that the textual can't do. And I had already been curating some disability in art, so I knew that I loved how disability culture could be expressed through art. But there's something so egalitarian and democratic and wonderful about these visuals. And when I heard you talk about, well, anybody can draw, and this taps into sort of a fundamental kind of creativity, it just made sense. And so what's interesting to me too is that it also pushes me to think about the medical side in ways I haven't before. I think so often as disability studies scholars, we can sort of say, oh, there's the medical model, got to mistrust it, and not really think with great nuance about what it means to be a caregiver or a medical practitioner. And so I've really appreciated the ways in which the visuals of graphic novels have brought to life that social experience of being a patient, but also the deep complexities of being a caregiver, whether that's a caregiver at home or a doctor or a nurse. Because we've read everything from psychiatric tales where Daryl Cunningham talks about being, a caregiver on a psychiatric hospital ward, to Ian Williams' Bad Doctor, where we read about being a doctor in rural England. So it's really just deepened my understanding of disability studies in new ways.
Oh, that's really exciting. I'm really excited and happy to hear that from you, from your perspective. And tell me, how are the students responding? What's the student response been?
It's been really great. I kind of figured they'd like it because the graphic novel is so a medium that they've grown up with. But it's been really interesting to me to see their reactions. I asked them this morning before coming to do this podcast what kind of things they would want me to say that they got out of the class. And so many of them talked about their surprise at how deeply the graphic memoir could make them understand the experience of illness. One student said something really funny. He said, when I signed up for this class, I thought it was going to be like Batman has PTSD. That's what I thought we were going to look at. He didn't even realize this was a genre of its own. Students said they really appreciated how the graphic memoir explored intersectional identities. So, for example, we're talking about Cancer Vixen right now, and they really appreciated how she not only talks about the experience of breast cancer, but also what does it mean to try to claim your attractiveness and sexuality even in the face of that. They talked about the fact that, especially my STEM and my pre-med students, they say, well, we get a lot of content about the biology of an illness in our classes, but we don't talk about the people who are experiencing this. And so one of my students said how much she loved my degeneration because, they might have talked about the biology of Alzheimer's, but thought not at all about that lived experience of being diagnosed at a relatively young age, of figuring out strategies for living with your illness. Some of them talked about how much they could relate to what they saw in the graphic novels. So, for example, when I taught marbles, and Alan Forney sort of shows what it's like to go through anxiety. And there's that panel where it's nothing but a series of pictures of her on the couch. And they immediately gravitated to that because they could understand, as students in a high-pressure atmosphere, some of whom have anxiety and depression, what that was giving voice to. Some of them talked about wanting more. They would love to know more about diversity, about the experience of what it means to be poor and go through illness, or to talk about racial issues. And one of the things we've talked about is who has the privilege to make and the time to make this kind of work, and what stories maybe aren't we hearing yet. So I think they've just really embraced it wholeheartedly in a way that I've been very grateful for. And by extension, in a way I'm grateful to you. I've used the collection by you and your collaborators, Graphic Medicine, and it's really helped inform our discussions in lots of rich ways. So.
Oh, that's really exciting. It's just so exciting to hear the ways that, it's all being brought to life. And that the way, it's especially exciting to hear how the students are receiving it and making meaning.
What's really interesting, too, is that one of the assignments I did was inspired by something you do with your students, where I'm having each of them present what I'm calling a comic artifact, where they have to read another graphic novel of their own choosing, and then they come and present on it. And it's been really interesting to me to see how sharply they've picked up on this idea of how authors use specific motifs, of how they've compared those motifs across graphic novels so that they see there's a real intertextual conversation emerging. It's interesting to me to see what purposes they make those choices for. So like I've had students choose graphic novels about anxiety, and I know that they themselves maybe are dealing with that issue, or students who choose a graphic novel because they want to learn. I had a student who chose El Defo because he wanted to learn more about what the experience of deafness was like for a teammate of his, or students who just chose something because they wanted to learn more about a particular disability or illness that they didn't know anything about. So it's been kind of cool to see how they explore their own curiosity about disability and illness in medicine in new ways through a form that feels very accessible to them. So that's been kind of cool.
Yeah. And what about drawing? Are they drawing also?
They are. Probably not enough. I'm still not quite brave enough, but one of the things I had them do was draw a self-introduction, and that was amazing. It kind of blew me away how vulnerable they were willing to be in drawing in a way that they might not have been in introducing themselves verbally, right? So they might have said, well, here's my rank, name, and serial number. Here's my major, my year, and here are my hobbies. But instead, I got everything from, one student who drew an image. She's a daughter of immigrants, and she drew this really powerful image of herself standing between two continents. And when she goes home, kind of the ways in which she feels drawn back into one experience versus coming to Davidson and being in the middle of another. And it was such a powerful visual articulation of something she was living with in the moment that I just was like, wow. So they've drawn self-introduction. They drew themselves relative to illnesses, whether of their own and also of relatives. I've tried to get them to draw responses to posts they do online, and some of them have taken me up on them, and some of them shied away. They're going to have to draw for their final project, too. They have to create a comic. So we'll see how that goes. One of the things I've had them do is write down a disability narrative, and then they're going to turn that into the thing that they illustrate. And we've had some really interesting conversations around that of, actually thinking about the fact that it's going to have to be a visual product, I think has made them better writers in a way.
Interesting.
Because as they've been drafting the story, I'll keep saying to them, well, how are you going to draw that? How is that going to be, how could that be translated into an image? And so in a wild way, it's pushed them to describe more because they know ultimately they're going to have to think about retranslating it back into the visual. And that's something I didn't expect. So that's been a kind of a cool thing that drawing has done to invigorate my pedagogy.
Oh, that's fascinating. That's wonderful. Gosh, that's so exciting. Wow, I just wish I could be in that classroom every time you teach it.
Me too. Well, I'm going to be doing it again next year. So it'll be really interesting to see what they want me to keep, what they think worked, what they think didn't, and also just to see what will happen in terms of the comics and what they produce. I think one of the things I'm really grateful to you and all the other people who work in graphic medicine for is there's something very liberating about saying to them, look, I haven't drawn, I'm not an art teacher, but we can all try this, and we can all try it together. And they seem to have really entered into that spirit very wholeheartedly. But I think that's partly what the genre, I mean, I think that's what you all who are sort of have been working in this field and this genre and really established it have given to those of us who are now going, what could it mean to try to do this? So I really appreciate that.
Oh, and I appreciate how willing you are to embrace those techniques. It's really exciting.
Oh, thanks.
And thanks again for taking the time to talk with me today.
Oh, my pleasure, MK, and thank you again.
That's it for this episode of the Graphic Medicine Podcast. As always, thanks for listening. And it's my pleasure to remind you that support for this podcast comes from Penn State College of Medicine, Department of Humanities, the nation's oldest humanities department within a medical school, pioneers of innovations in medical education since 1967. Thanks for listening, and have a great week.